On today's episode of 26 Minutes with Dr. Warren Siegel on the Zermed Show, we delve into an incredibly important and very timely topic, breast health. Whether you're seeking knowledge for yourself or for a loved one, this episode promises to be both informative and empowering. I'm your host, Dr. Warren Siegel. Joining me today is a very special guest, physician assistant Alla, a renowned expert in the field. Thank you so much for joining us, Mrs. Vol.
My pleasure.
So tell me a little bit about yourself.
So I came here to this country in 1992. I am from Belarus, former Soviet Union. I actually left when it was still Soviet Union. I came here, went to high school, ended up in Hunter College as an undergraduate, and then transferred over to Long Island University for a physician assistant program. I graduated from Long Island University with my Bachelor of Science degree and also a physician assistant license. Since then, I've been working in different facilities, and my most permanent job was here, and it's been 23 years that I have been in this facility. I worked for about 7 years in the emergency room, and then I switched over to work in surgical clinics where breast clinic is actually my main place to be, which I love with all my heart.
Oh, that's wonderful. Can you explain a little bit, what does a physician assistant do, actually?
So physician assistant works alongside doctor to be able to help a lot more people, to facilitate things, to help, to diagnose people, and to treat them.
So you work with a physician.
Correct.
And your particular area of specialization is breast health?
Correct.
So tell me a little bit about what makes breasts so important and why do they need to be so healthy?
Well, women obviously worry a lot about their breasts. And whenever there's any kind of pain or anything that happens, it's a good idea to go and see the doctor. We as breast care doctors recommend start doing mammograms at around 40 years old and do them yearly after that. The reason breast mammograms are so important is because most of the time they can find some abnormalities such as cancer that can be caught much earlier in life, and you may require much less aggressive treatment. So when that happens, you might not still have any kind of physical examination, any kind of symptoms. So that's very important.
So when you mention physical exam, I've always heard about the importance of doing breast self-exams. That for years I've heard women should be examining their breasts every month. Is that still true?
So it's funny you ask that. The research shows that it's not any more beneficial for women to do self-breast examinations. It has not shown that we find breast cancer detected any earlier. Most of the time when women are bathing or changing, they'll find some kind of changes in their breasts, any lumps, any color changes, or things like that. Sometimes it's funny, but a significant other may find those type of things, and then that's how they recognize it. Women should though know how they usually look and how their breast usually feels, and if they do see any abnormalities or changes, then they should definitely reach out to their primary care physician, to their gynecologist, and then request to have a mammogram, and that's when the doctor usually will give you a referral, whether it's a mammogram or any kind of imaging that needs to be done for the breast.
So let's talk about mammograms in a few minutes, but before the mammogram, you're saying that women don't necessarily have to examine their breasts every month,
Yes.
but are there times when you might have a lump or a bump or different changes that are completely normal?
Yes, absolutely. So not all breast lumps are common, and not all breast lumps are cancerous, even though there can be. Most of the breast lumps are actually not cancerous, and the two most common conditions that can cause breast cancer are fibrocystic breast conditions and cysts. Cysts are very common in women, and what are cysts? Cyst is a little balloon that has water in it. That's what I explain it to my patients, so in a simple terminology. And they tend to just stay there. Sometimes they can change, they get bigger, sometimes they can get smaller. We just monitor them and make sure that they don't change in size, in shape, or anything like that that could cause something potentially more dangerous.
So at what age should women start worrying about their breasts? I mean, is this something that teenage girls should be worrying about? Or you mentioned 40 for mammograms, but is that under 40 nothing to worry about?
That's not the case. So if you do feel, young women sometimes when they do have some kind of physical activities they're doing, or they're changing, or they feel something in their breast, yes, it is true that young women, even at 15, at 16 years old, they can have some breast lumps, and they should get them checked. But most commonly they're benign. So in women who are younger than 40 years old, I would just say be aware of how your breast feels, be aware of how your breast looks, so this way that if there's any kind of changes or you do feel something, that you reach out for help.
So what would be the signs or symptoms that I should go to my doctor or my gynecologist and say, I'm worried about my breast?
Okay, so there's a few things that I think would be important. One is definitely feeling a lump. Two, some kind of skin changes. If you have some redness on your breast, sometimes it can be very tender to touch. Sometimes it can be maybe a discharge from a nipple, things like that. So that would definitely be something that would be concerning and worth checking out with your parents.
So lumps and bumps, discharge from the nipple, and changes in the skin, so the color actually changes. What about pain?
Pain is probably the most common reason why people are worried about their breast. Most women assume the worst. The minute they have breast pain, they're very concerned. They think it's cancer. And I would like to reiterate to everybody that breast pain does not mean you have cancer. It is very important to think about all these things. But you also need to know that there's different types of breast pain. We consider pains that are, we divide pains into cyclical pains and non-cyclical pains. And both of them are most of the time benign. So the cyclical pain would be a pain that patient experiences before their menstrual period. For a week or two before the period starts, their breasts start being enlarged and painful. And then after the period, maybe a few more days, the pain should go away. And a non-cyclical pain is the pain that the patient would have at any moment in time. It can be once a month, it can be once a year, it can be on and off, it can be for some period of time. So what we usually recommend is go speak to somebody. 77% of the time, and one time or another, the woman would be actually experiencing breast pain. And we don't consider it a disease. We can actually consider it as a bodily process or a condition that most women have. So it's good to go and speak to somebody so they can reassure you and make sure that you don't feel it's very scary. I understand that. So if you do have pain, there's certain things to do for it would be maybe wear a well-fitting bra, such as sports bra, that can help pain a little bit. Reassuring a patient that it's not cancer can also be calming, and patient will be able to tolerate their pain a little bit better. Also, stop smoking. As we always say, smoking is not good for you. Smoking is definitely something that has a little bit of an, cause for pain in the breast. People who are a little overweight, it also will help to lose some weight, and that can relieve the pain of the breast. We as doctors also recommend using what's called the primrose oil capsules. It's not a medication, it's a natural remedy. It's made out of a flower, an actual extract from the flower, And sometimes if we recommend taking it for about at least 6 months to start seeing some kind of symptoms. However, before doing that, please consult the physician. Please talk to them because they need to give you the right dose and explain everything to you and see how that's going to work. And I did have a 31-year-old, and I will never forget her. She was a wonderful, wonderful woman. Came in complaining she was in so much pain. She couldn't lay down on the bed. She couldn't turn from side to side. It was so painful to wear a bra. Just severe breast pain. And I prescribed her this Primrose oil. She took it for about 6 months. She came back to me. I have never seen the change in her face. She was so excited. She was so happy, and it helped.
Is this a tablet that you take or a cream?
It's a little capsule, and they sell them usually in natural stores and sometimes on Amazon. And it helps. It doesn't help everybody. Some people react differently from different things that they try, but it's something that is worth trying if you're in severe pain and it's bothering you. And an old remedy of Tylenol and Motrin definitely will help if the pain is becoming debilitating or something is your quality of life is being affected by the
So I
disease.
assume those are things that you would want if you have what you call cyclical pain. Every single month just before my period or during my period, or you can predict it. The non-cyclical pain, is that
You can
something
still use it for a non-cyclical pain
as well?
Absolutely, as well. It depends, because some non-cyclical pains will come and go at a very random time. So sometimes they will last maybe for about a week or two and wouldn't be related to the cycle that you're having. So it actually also helps. I've
So
seen it
at
help.
what point should I seek medical attention? At what point should I go to my primary care doctor, my physician assistant, my nurse practitioner, my gynecologist, and say, I'm really worried? At what point should I be worried?
Well, I would say that if the pain lasts more than once, more than twice, it lasts every month, it's becoming a routine that you're having this pain, and for any reason that you're concerned about. So if, let's say, pain is here once and it resolves on its own and it never comes back to bother you, I probably wouldn't be worried too much about it.
Okay. You mentioned discharge from the nipple. Can you say more about that? What causes that? And is that something that continues on, or is that just every now and then?
Yeah, so nipple discharge is actually very normal, and women see it as something abnormal because now you have this liquid coming out of your nipple and you're concerned about it. It's common, it happens a lot in women. The color of the nipple discharge can be different. It can be clear, it can be white, it can be yellowish, greenish, brown. So, and women, it's funny, but they tend to squeeze their nipples to get more discharge, which is probably not the best thing to do. So the more you squeeze the nipples, the more this discharge will come out. So we try to say, hey, you know what, just leave the breast alone. And the less you squeeze your nipples, the less the discharge will be developed. The concern with nipple discharge is when you see a bloody color. So that would be a little bit concerning. So I would recommend going to your medical provider as soon as you see bloody discharge so they can further investigate it.
So lumps and bumps may be completely normal, probably nothing to go crazy about.
Sure.
Changes of the skin might be cause for concern, but again, nothing to freak out.
Yes.
Nipple discharge may be normal, but if there's blood in it, that's more concerning
Yes.
than if it's anything else. And if I'm worried, what are the things I should do? You mentioned go to your primary care doctor. Can anybody deal with your breasts?
Primary care doctors or gynecologists would probably be the best people to start with. If they have a concern and they need a little more further workup with different types of imaging or other kind of things that need to be done, they will refer you to a breast surgeon. So the breast surgeon will be able to help with all the other imaging tests and things to facilitate further workup of whatever the situation may be.
Wow, that sounds scary. When I hear the word surgeon, I think I'm going to lose something. Somebody's going to take something out that I was born with. If you go to a breast surgeon, though, it sounds like you're saying they just order the test to determine if you need surgery. Is that right?
Yes. So you go to a breast surgeon who's have a little bit more experience with the specific details of what the issue may be, whether it's a lump, whether it's a discharge, whether it's just an infection, whether it's a woman who just gave birth and she has some inflammation in her breast and she's concerned about it. So when they come to us, breast surgeon, this is who I work with, then we just speak to them. We obviously reassure the patients. We order the test, whether they need some kind of antibiotics or medications. So that's when the surgeon will discuss everything with you.
Oh, so you mentioned antibiotics. Is that a treatment for cancer?
Antibiotic is not a treatment for cancer. Antibiotics we usually give to patients in case of any kind of infection. If there is a breast infection and there's some redness or swelling and things like that, so that's when we would give the antibiotics, but it's definitely not a treatment.
So all the things that you just talked about, you talked about the lumps, the bumps, the nipple discharge, the change in skin color, it may also be just a sign that I need an antibiotic to treat an infection.
Absolutely.
Oh, that's very helpful to know. So if I'm concerned because I'm worried about having breast cancer, what are the things that I need to know? I've always heard that you should know about your family history. Can you talk a little bit about that?
Yes, absolutely. So as we know, for breast cancers, there are some risk factors that people have. For breast cancer particularly, if you have first-degree relatives such as your sister, your mother, your grandmother that have a history of breast cancer, so that would be a risk factor for the breast cancer. So as plenty of other risk factors. Risk factors, by definition, is something that will increase your risk of having breast cancer. However, if you have one or more risk factors for cancer, that does not mean that for sure you're definitely going to have that cancer at one point or another in your life. And those risks, besides just having relatives with breast cancer, would include something like not having children all your life, or having menstruation, or starting your menstruation before 13 years old, or your menopause starts after 55.
Wait, I'm sorry. Not having children puts me at higher risk for breast cancer?
Correct.
Not having children?
Not having children.
Wow.
At all.
And having my first period before 13?
Yes.
Puts you at higher risk?
Puts you at higher risk.
Didn't know that. That's
Yeah.
fascinating. And what was the third thing you mentioned? I'm sorry.
Postmenopausal, when they do hormone replacement therapy, patients give it. And another interesting thing, a lot of women do use oral contraceptives, right? So the oral contraceptive that use hormones, such as estrogen, can put you a little bit at risk also for breast cancer.
Mm-hmm.
So sometimes you need to speak to about that to your physician or whoever the provider that you're seeing. As we always say, smoking, weight, those have been recently found to have a small increased risk for breast cancer. And even now they're researching physical activity. They say that a person or a woman or man, whoever it is, woman in particular, postmenopausal, after having the menopause, should do exercises at least maybe 150 or to 300 minutes a week. That will lower the risk of having breast cancer.
You mentioned men. We're going to talk about that in a few minutes, but I wanted to follow up. You mentioned that some women who are on birth control pills that may contain estrogen may be at a very small, higher risk, but having no children puts you at higher risk. So if you're using contraception to keep from getting pregnant, that can put you at higher risk for breast cancer. That's fascinating.
I know, and it
That's
depends
very
on what
interesting.
type of hormones they're using.
So it sounds like you need to talk to whoever is giving you your gynecologist or your primary care doctor. And I think you mentioned 40 for your first mammogram. Should every woman have a mammogram starting at 40? That seems very young.
Correct. So I'm a big believer in my experience, and we here do recommend women doing their mammograms at 40 years old. However, if you do a research and you see that American Cancer Society, they recommend starting at 45 years old. From my personal experience, I would feel better as a provider for women to start doing their mammograms at 40 years old and continue doing them yearly. So this way, as I said before, you can detect your cancer much earlier, and the treatment will be much less aggressive.
So it sounds like, once again, everything I talk about is the earlier you know, the better off you are.
Yes.
The healthier you live, lifestyle, hopefully you will be healthy. Is there any downside to having mammograms starting at 40 every single year? Is there a downside?
There is a very small exposure of radiation while you're doing your mammograms. However, your benefits versus the downside to it is probably better to do the mammogram than not.
And I've always heard that mammograms hurt. Is that true?
Yes, mammograms are very painful. They do literally take your breast and they squeeze it between the machines. So
well, you make it sound like a wonderful test. Why would, I mean, if it's that painful, why are people going to get it?
So mammogram is an excellent screening tool for early detection of breast cancer. Sometimes you're able to detect cancer right before it even goes into the actual cancer. We're able to do more tests and find out. So it is important, despite the fact that it's uncomfortable. It is very important.
Is it uncomfortable or painful?
I would
say I don't like pain.
Everybody is different. I would say it's more uncomfortable than painful.
And where do you go to get a mammogram? Is it easy to get?
There are facilities that are special facilities that have imaging where you can go and get your mammograms and your other imaging done. There's also hospitals where every hospital has a radiology department, and that's where they do the mammogram.
So I've always heard that you can get a sonogram instead of a mammogram. Is that just as good at making the diagnosis?
And that's what my patients all want. Mm-hmm. However, breast ultrasound is not considered to be a screening tool. So sonograms will not visualize sometimes the details that the mammogram can detect. So the cases that we use the ultrasound for is, for example, if during a physical examination that the doctor feels something, they'll send them for a quick sonogram. Or if the patient has very dense breast, sometimes very dense breast, you may not be able to see certain things on the mammogram, so we will order an additional imaging, which is a sonogram, to find more details about.
How do I know if I have a dense breast? What does that mean?
The dense breast is just a thick breast tissue, and usually the mammogram will show that.
Very helpful. So it sounds like starting at 40 or 45, I should be asking my doctor for a referral for a yearly mammogram. If I'm a woman, if I have any questions, if I'm concerned, I should go to my gynecologist, go to my primary care doctor, my nurse practitioner, my PA, and say, I'm worried, let's have the discussion. We haven't talked about men. So much of what I hear about when we talk about breast cancer is women. I never hear about men getting breast cancer. Is it true? Do men get breast cancer too?
It is true. Men do get breast cancer, and I've had a few patients few males that had breast cancer. The cases that I have had are mostly genetically predisposed with a high risk of having a mother or a sister or somebody like that, like a first degree relative who had.
So it's just like a woman getting breast cancer.
Absolutely.
So why don't we hear more about men getting breast cancer?
So the way men usually find their breast cancers is they're examining their breast, not examining it, or maybe they're just doing their bathing or getting dressed and they feel a lump. They definitely are concerned. Men are probably a little bit more aware their breasts are not sometimes as big as women's breasts are, so they're able to feel more things, and then they'll come and reach out to a practitioner and find out and ask us what can be done and how we can find out why do we have the lump in the breast.
Well, that's very interesting. You know, we've done shows where we've talked, and people have said the exact opposite, that men are less likely to go to prevention. But you're saying if a man feels a lump, they're more likely to get worried and go to the doctor?
This is what I have seen from my
That's
experience.
very, very interesting. It's something we don't talk a lot about, but are they, so you said that they're at higher risk if their mother, their sister, just like women, have had breast cancer. And I assume it's the same association with smoking, with being overweight.
Yes, correct.
And Is the workup the same? All the tests are the same?
Workup is absolutely the same.
So men go for a mammogram?
Absolutely. We send men for mammogram and an ultrasound if needed to be. Absolutely the same exact, and we're able to find things the same way.
So let's talk about treatment. I am worried. I go to see you. I go to see my primary care doctor, my gynecologist. They do all these tests. And in the end, it turns out that I have breast cancer. What's next?
So before I talk about that, I just wanted to mention something. To get to the point where we do find out that you do have breast cancer, we need to do a few extra tests. Once we find out that the mammogram is abnormal and there's some abnormal findings that we're concerned about, we'll offer a patient to do either a mammogram guided biopsy or an ultrasound guided biopsy, and it will give us a definite diagnosis whether it is or it's not cancer. And we always say, if we see some kind of little calcium deposits on the mammogram, which they are not really calcium, but they look like little dots on the mammogram, and I try to explain that to my patients so they have a clearer understanding of what mammogram abnormal findings are, then we would recommend doing a mammogram guided biopsy. And what that entails is they'll go to a radiology department where they did their sonogram and a mammogram, and a doctor who's a radiologist, called an interventional radiologist, will be able to do those biopsies. And then once we find out that this is cancer, then we can go a few different ways. We can do either surgery, or we can send the patient to an oncologist if they need maybe some kind of chemotherapy prior to treatment, and we discuss all the possible options.
So just because I have an abnormal mammogram does not mean I have cancer?
Absolutely.
Doesn't mean it's all over, and doesn't mean I have to go right to the oncologist.
No.
So once again, the earlier I find out, the better off my prognosis, and then you can figure out what the appropriate
Yes.
treatment is.
And we send you to proper channels and do other testing that needs to be done.
Thank you so much. That is so helpful, and I really do appreciate you being here today.
Thank you very much.
And that brings us to the end of our program today. We sincerely thank you for tuning in and learning alongside us. For more information about our show, please don't hesitate to call us at 718-510-2103 or visit us online at www.zormed.com. Stay updated and engaged with South Brooklyn Health by visiting our website at www.nychealthandhospitals.org/South Brooklyn-Health. This broadcast was proudly brought to you by Brick Media in partnership with South Brooklyn Health. Until we meet again, stay informed and please stay well.